My name is Sara Budge. I'm a licensed psychologist in Oregon and the VP and Director of Client Services at Life After Hate. We're an organization that works with individuals who are or were involved in violent far-right extremist groups. We help with disengagement, de-radicalization, and reintegration into society. I'm here to talk about trauma-informed practice and how that can help with your work with individuals who may be involved in violent extremism. My hope is that this class will teach you a little bit about trauma, individual trauma, and adverse childhood experiences, some of the behavioral, cognitive, and interpersonal impacts that trauma can have, and how those might be showing up in your clients. And also give you some practical tips for practices that you can integrate into your own work with individuals. So first, let's talk about trauma. This is a term that's used extensively in lots of different contexts. The Substance Abuse and Mental Health Services Administration defines individual trauma as something that results from an event, a series of events, or a set of circumstances that's experienced by the individual as physically or emotionally harmful or even life-threatening. And it has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. It's important to know that trauma can happen at any point in the lifespan, and it can occur repeatedly during the lifespan. We find that there are high rates of traumatic experiences reported during incarceration, including victimization and abuse, solitary confinement and coercion, and strong correlations with the later development of post-traumatic stress disorder. So many of your clients who have experienced trauma in their childhood are also potentially experiencing trauma in their incarceration experiences. In fact, if you think about the SAMHSA definition of trauma, these events, series events, or circumstances that are experienced as physically or emotionally harmful or life-threatening are frequently occurring in the context of incarceration. We also look at something we call adverse childhood experiences, or ACEs. And adverse childhood experiences can include things like trauma, those physically life-threatening experiences, but it's even more complex than that. The reason we study adverse childhood experiences is that they are implicated in long-term, potentially in long-term, lifelong effects on mental and physical health. But of course, we also see the impact of adverse childhood experiences in problematic health behaviors like smoking or excessive drinking. And also, high rates of adverse childhood experiences are associated with socioeconomic challenges like unemployment and early school dropout. We divide adverse childhood experiences into three categories: abuse, household challenges, and neglect. And abuse is probably more of what you think of when you think of trauma. Abuse can be emotional abuse. This is if a parent, a step-parent, or an adult living in your home swore at you, insulted you, put you down, or acted in a way that made you afraid, or afraid that you might be physically hurt. Physical abuse clearly is evident when a parent, a step-parent, or an adult living in your home pushed, grabbed, slapped, threw something at you, or hit you so hard you had marks or were injured. And then, of course, sexual abuse. And this is, again, when an adult in your life or in the home or a stranger who is at least 5 years older than you touched, fondled one's body in a sexual way, or made you touch his or her body in a sexual way, or attempted to have any type of sexual intercourse with you. These are the kinds of trauma experiences in childhood that people readily think of. But it's also important to look at the impact of household challenges and neglect that may have just as big an impact, or when combined with those abuse experiences, can have a synergistic effect and basically an exponential effect on people's functioning later on. Household challenges in particular that are very common, especially among incarcerated populations, are having witnessed domestic violence in the household. So seeing their mother treated violently, so a mother or stepmother was pushed, slapped, kicked, grabbed, or had something thrown at her, bitten, hit with a fist, hit with something hard, repeatedly hit for at least over a few minutes, or threatened to be hurt with either a knife or a gun or by some other weapon by a father or another male figure in the household, or a mother's boyfriend. Substance abuse in the household, and particularly a household member with a substance abuse disorder that was or undertreated, like a problematic drinker or drug user. And mental illness in the household. So parents in particular who had or undertreated mental illnesses, particularly if household members were depressed or mentally ill, or a household member attempted suicide. Parental separation and divorce is also listed as an adverse childhood experience, and having an incarcerated household member is also an adverse childhood experience. Now, you may hear this and think in particular, some of these are very common, such as parental separation or divorce. Having a single adverse childhood experience does not necessarily predict adverse outcomes. It's the more adverse childhood experiences a person has that is more likely to correlate to later problematic outcomes. And it's also the combination of effects. But you could see how having parental separation or divorce could influence the stability of a household and might actually lead to some of these other household challenges, neglect, or abuse experiences happening. So let's also talk about neglect. And the category of neglect includes emotional neglect, which is when someone in your family never or rarely helped you feel important or special. You never or rarely felt loved. If people in your family never or rarely looked out for each other, and you never felt close to each other, or your family was never or rarely a source of strength or support. I think it's important to recognize that for some people, emotional neglect, can be that much more traumatic and problematic than physical neglect, which is when someone was not physically taking care of you, protecting you, taking you to the doctor when you needed it. You didn't have enough to eat, or your parents were too drunk or high to take care of you, or you had to wear dirty clothes, for example. Those emotional neglect experiences can be just as traumatic and more problematic for children than perhaps even a physical neglect experience. It leads to people feeling as if they were unworthy of care and love. So again, repeated chronic trauma and adverse childhood experiences can have these lifelong effects on physical and mental health. Having experienced multiple adverse childhood experiences is strongly associated with involvement in the criminal justice system during adolescence, early and middle adulthood. Having experienced multiple adverse childhood experiences is also associated with being more likely to be arrested and to have multiple arrests, more likely to be incarcerated, and to be incarcerated multiple times, and to have spent longer periods of time incarcerated. So we know that trauma and adverse childhood experiences are very important and are predictors or correlates that are associated with some people's involvement in crime and the criminal justice system. However, I want to take a moment and say that it's important for us to recognize that the most common response to trauma is actually resilience. Resilience is the process of overcoming adversity. So as if you were looking at those adverse childhood experiences, thinking about how you may have experienced many of them, or that you know many people who have, yes, absolutely. Many people experience resilience in the face of trauma and adverse childhood experiences. There are assets or resources that improve a person's ability to cope with trauma and ACEs when they occur in their life. Assets might be things that are internal to the individual, like competence, coping skills, self-efficacy, their sense of their ability to manage and handle the stressors that they're experiencing. They could be resources. These would be things external to the individual, so parental support and monitoring, adult mentoring, community organizations that promote positive youth development. So we can see how these protective factors in the form of assets and resources could buffer the effect of trauma and adverse childhood experiences. It's really important to note that the presence during childhood of an adult who made a person feel safe and protected is an essential protective factor that promotes resilience in the face of ACEs. It doesn't mean that these trauma and adverse childhood experiences aren't painful. It's that the long-term impact on their behaviors and their physical health and their mental health may be mitigated by having that one adult person who clearly shows that they care about them and will care for them. However, I think it's really important to recognize that the population of people you work with probably did not have adequate resilience, and they didn't have adequate protective factors to build that resilience. They wouldn't be involved in the criminal justice system if they had those coping skills and those resilience factors. And this is where trauma-informed practice is important. So trauma-informed care and trauma-informed practice comes from the Substance Abuse and Mental Health Services Administration. And what we know is that there are particular ways that we can interact with people to reduce the likelihood of re-traumatizing them and productively interact in a way so that we can help them to live better, more productive lives. And given that significant history between trauma and adverse childhood experiences, between arrest and incarceration, in addition to the additional traumatic experiences associated with their criminal behavior and their later incarceration, it's not unreasonable to assume that most of your clients have trauma histories. It's important then for us to think about the ways you can consider the impact of trauma, not as an excuse, but as a foundation for the reasons your clients behave the way they do. So trauma-informed practice starts by realizing the widespread impact of trauma in your clients, also in yourself and potentially in your colleagues and in your community. It's recognizing the signs and the symptoms of trauma in your clients or in yourself or in the way the system operates, and responding and implementing trauma-informed practices, which should hopefully lead to this reduction in re-traumatization. Trauma can cause prolonged activation of the human stress response, and that can impact the brain and the body during childhood development and throughout the lifespan. Without adequate protective factors and supports, the psychological and the neurophysiological effects can translate into problematic behaviors. So what we see is that changes in the brain as a result of experiencing chronic trauma and the stressors and the hormones associated with that change the way that the brain operates and change the way the brain is structured. This can impact attention and concentration, which can make it difficult for people to complete school. It can cause difficulty with emotion regulation and impulsivity, which could increase risk-taking behavior. And it can lead to engaging in really high-risk behaviors like drug and alcohol use and crime and violence. So it's important to recognize some of the potential signs of the effects of trauma in your clients. This could include things like addictions, including substance abuse or alcoholism, drugs and alcohol. It could be sexual problems, problematic sexual acting out and sexually violent behavior, or it could be sexual behavior that's considered within the norm but unhealthy for that individual. The inability to maintain healthy and close relationships, friendships, and social interactions can be an impact of trauma. Hostility or antisocial behavior is very common, as is social withdrawal. Self-destructive behaviors, impulsive behaviors, and reactive thoughts, perceiving someone else as threatening them when there is no objective threat, and feelings of depression, shame, hopelessness, or despair. Many of these are probably evident in your clients, and these could actually be the signs of trauma and adverse childhood experiences or trauma from their experience in incarceration. Post-traumatic stress disorder is the diagnosis that we give with someone who's having a severe maladaptive response to trauma. The required diagnostic criteria for post-traumatic stress disorder includes having experienced exposure or actual to threatened death, serious injury, or sexual violence. And individuals with PTSD diagnoses have to have a list of different symptoms from the following categories, intrusive symptoms, which could be things like recurrent, involuntary, intrusive, distressing memories, distressing dreams, or dissociative reactions, or what people commonly call flashbacks. We also see avoidance symptoms, and this is when people try to avoid thinking about the traumatic experience or avoid experiences or environments or stimuli that might remind them of that traumatic experience, that arouse those memories or thoughts or feelings. We also see negative alterations in cognitions and mood associated with that traumatic event. So it could be inability to remember key parts of that traumatic event, or persistent negative, exaggerated beliefs about the self, or expectations about the self, others, and the world. It can be things like, I am bad, no one can be trusted, the world is completely dangerous, and my whole system is completely ruined. I will never be able to function in society in a normal way. We also see persistent negative states, emotional states, and persistent distorted cognitions or ways of thinking about the experience, like blaming oneself or hyper-blaming others, for example. And then finally, we also see marked alterations in arousal or reactivity. This is where people are hyper-vigilant for threats. They may have difficulty sleeping and experience a lot of nightmares. They may be irritable. They may be reckless and engage in self-destructive behavior and have problems with concentration. It's important to note that people can have trauma and adverse childhood experiences that have a significant impact on their life, but not be diagnosed with post-traumatic stress disorder. It does not mean that trauma and adverse childhood experiences haven't affected their functioning and haven't had a maladaptive effect on them, but they may not meet this stringent criteria for PTSD diagnoses. It's important for us to remember that it doesn't actually matter if a person meets the criteria for a PTSD diagnosis. We can still assume that trauma has had an impact in their life and that we can contribute to a positive outcome through our relationships with individual by understanding, I'm going to start this over. It's important to know that it doesn't matter if a person has a diagnosis of PTSD or not, they may still have the impact of trauma in their life. And every positive relationship can contribute to positive change in your clients. So they may have PTSD or they may not. They may have adverse childhood experiences and trauma, or they may not. Trauma-informed practice means assuming everyone has trauma and engaging in particular behaviors to ensure we don't make trauma worse. Establishing a trauma-informed relationship with your client is really essential. It doesn't mean that you're going to become their best friend or their confidant, nor does it mean that you're going to trust or believe everything they say to you. It means that you will work to get to know your client and find some way to appreciate who they are as an individual. Using some trauma-informed practices with your client can help to avoid this re-traumatization and hopefully can help with their reintegration into society. Trauma-informed practices include establishing a sense of safety, and that may mean literally ensuring that the physical environment that they are in, especially when you meet together, feels as safe as possible to both of you. It's also establishing trustworthiness and transparency. It's following through on saying what you're going to, if you're going to do something, you do what you say you're going to do. But it's also being transparent about what you're doing and why you're doing it. We also find it's really important to engage in collaboration and mutuality. So it isn't just one person telling another person what to do. It's asking your client, what do you want to work on first? What's important to you? Well, here's the other thing in transparency. Here is the other thing that I see as an issue for you. You want to work on this. I also think you should work on this. Let's work on these two things. We also want to ensure that clients have an appropriate empowerment, voice, and choice. And again, I emphasize appropriate. They need some empowerment, some voice and choice, but we also know there are some things they cannot do and they cannot have because of other constraints on their freedoms. And we also need to be mindful of cultural, historical, and gender issues and the ways that those influence your interactions with this client, and just be aware of them and maybe even explicitly talk about them with the client. If you're going to establish a trauma-informed relationship with your client, it will require adopting a particular mindset and some behaviors when interacting with potentially difficult clients. So let's talk about establishing this relationship and this trauma-informed mindset. Establishing a relationship with difficult clients who don't really want you in their life and don't think they have any problems can be very challenging. But it really does begin with your mindset. First, it can be really helpful to remind yourself that the client is not their offense. This is a person who may have engaged in some really horrific behavior in many cases, but many people have the capacity to change, even if they haven't demonstrated it yet. So even though you may not have seen overt signs that they are changing, they're changing the way they think, they're changing the way that they want to behave in the world, their motivations are changing, there may be these invisible changes in the way they're thinking about themselves and their decisions. Working from a trauma-informed perspective also means shifting your mindset from what is wrong with you to what happened to you. How did you get to this place in your life? And to be clear, I don't mean that you need to ask for their deepest, darkest secrets and to ask about those traumatic histories, but you can ask, what was your experience like, for example, while incarcerated? What was that experience like? What was your experience like growing up? And getting to know their stories. It's important to acknowledge and understand the vulnerabilities or the reasons, underlying reasons why your client may have become involved in the criminal justice system. Just because you're trying to understand those reasons doesn't mean you're excusing their behavior. You're just trying to understand how they got to where they are, not as an excuse, just as a part of the explanation of why would you have made the kinds of decisions and been through the series of events that you put yourself into typically. It can help to remind yourself that trauma impacts the way people's brains function. And it can help to remind you that they are making decisions with faulty equipment, essentially, that has been changed by their traumatic experiences. It's also really important when interacting with someone who may have a trauma history is to be very aware of power differences. There is an inherent power difference in the relationship you have with your clients. And it's most likely that the relationships your clients have had with people who had power over them in the past have not been positive relationships. They have probably not had good relationships with people who have authority over them. And in fact have probably been adversarial relationships in many cases. And remember that this may date back to the very earliest days of childhood if their parents were abusive or neglectful, if teachers and school administration were constantly punishing them because they made poor decisions in the classroom and they couldn't concentrate and they couldn't be successful in school. Or they've also had long histories involved in the criminal justice system. They have a very particular way of responding to authority that may, again, have been baked into the cake since their very earliest days of childhood. So when you're in this position of power and when this person reacts negatively to you and when they don't want anything to do with you, it's really important to not take it personally. And I know this is easier said than done, but it can help to literally use the mantra, this isn't about me, this is about them. This isn't about what's wrong with them, it is about what happened to them to get to this point. And finally, one of the most important things about working with individuals who have trauma histories, particularly those who are difficult to establish relationships with, is to remember that kindness is not weakness. Kindness doesn't mean that you don't establish and maintain appropriate boundaries. It doesn't mean that you believe every single thing that they say. It doesn't mean that you excuse their behavior. Kindness means you treat them with an amount of compassion that you would hope someone would show you or someone that you care about. We actually find that using kindness and compassion in interactions, even with the most difficult, the most aversive and aggressive clients, is the most productive way to get them to engage with you and to eventually change their behavior. So adopting that trauma-informed mindset isn't quite enough. We also have to engage in trauma-informed behaviors. And one of the most trauma-informed behaviors most important ones that you can engage in is non-judgmental interactions with a healthy dose of skepticism. Again, this means that you're interacting with someone with compassion, trying to remove as much judgment as possible from your interactions with them. However, that doesn't mean that you believe everything that they say and you just take everything at face value. It is okay, of course, to be non-judgmental, but also hold a sense of skepticism in those interactions. I also think it's really important to just be curious. If you can this may be a piece of mindset, come with curiosity, come with an interest in understanding this particular person, their particular way of seeing the world. Ask questions, not just the questions that you need to ask for the monitoring and the supervision, but be curious about who they are and what they like to do. One of the most powerful and informative questions that I like to ask is, tell me your story. Tell me about your life. And if they ask, like, well, what do you mean? Where? Be like, I don't know. Tell me anywhere. Tell me about your life as a kid. Tell me about your life as a teenager. Tell me about your life as an adult. This has multiple positive benefits. One, you're going to get to hear some really important information about the factors that you want to change in their life that you know are going to affect their ability to reintegrate into society. Two, you are showing that you care about getting to know them as a person, not just as a person who committed a crime. So use that opportunity to just be curious, and you're going to learn about how they think, how they see the world, and how best you can help them modify their behaviors to function in society. The other piece about this curiosity that they're probably not often asked is to be curious about their strengths. Ask them, what are you good at? And be like, look, you're probably good at some things that are criminal, right? You're probably good at some problematic behaviors. It doesn't matter. What are you good at? Because even the things that you are good at in the criminal space, we can change and apply in a new way outside of criminal behavior. Also, it's important to ask people, what are you proud of? You're going to get a sense for what's important to this person and what might be worth it to them to hold on to facilitate, to enhance, and what they want to make change for. Finally, another important trauma-informed behavior is being transparent whenever possible. This means giving lots of information about what you're doing or what you're going to do whenever possible. And it may not always be possible, let's be clear. But sometimes the most important thing you can do is explain to a person why you are doing something. Assume they have no idea why. So when you're working with someone on those criminogenic factors that you know might lead them back into the criminal justice system and become incarcerated again, it could be things like being really transparent about their social network and their peers. Like, listen, I think these people are probably not helping you. And in fact, I think they may be a major source of risk for you in your life and going back to prison. I know these people are important to you and that they play an important role in your life. However, I would love to see you build additional relationships out of this. It's being transparent about what you're trying to do. Use those motivational interviewing skills to develop their motivation to change, but also use transparency when possible. Finally, it's really important to use choice, collaboration, and empowerment when practical. And again, I'm not saying this is possible in all cases, and it's not always possible in all instances with certain behaviors. But the first thing you do in this process is just acknowledge that most people don't like relationships in which someone else has power over them, And I would say this in a transparent way. You don't blame them. I don't blame you for not wanting me to be around. I don't blame you if you don't like this relationship and you don't want to work with me. Just lay it out in the open. Make sure that you emphasize that it's not about you as a person, it's not about them as a person, it's just about this particular dynamic of this relationship. But you are here to help them. You are here to help them lead a better life, to make sure that they don't go back to prison. And it really is about them, and what they put into it is what they'll get out of it, of course. If you can, you are going to give some kind of choice. However, sometimes you're going to have to make decisions without their collaboration. Always explain why, if you can. Over-explain why you're doing things. Remember, your client has a lot of life experience with decisions being made for them, and probably rarely with their input. They also have a lot of negative experiences with authority. If you can diffuse some of that power differential by explaining why and talking about the reasons behind that, you can help to reduce some of that sense of power and authority and that mystery and demystify the reasons why you're doing what you're doing. However, when it's possible, share decisions and share decision making when you can. I'd like to walk through your house. Where would you like me to start? Obviously, you're going to need to check all the rooms, but that might be one place with some people that you can offer them choice. I'd like to meet with you. Would you like to meet inside or outside of your workplace? You may see some areas in your client's life that need to or really could change. It's also helpful if you start with the things that they're willing to work on first. And so when you're doing that collaborative goal setting, that's when you're going to ask things like, what's the most important part of your life that you want to work on first? Well, in full transparency, I also see this as an issue. Maybe we work on those two things together at the same time. Ideally, you can use those motivational interviewing skills to help them see that what you want them to work on is also important, but it's also important to use that collaboration and talk to them about what's important to them and what they want to adjust. Finally, empowerment comes from feeling successful and acknowledging even the smallest incremental steps toward progress can be really, really important to making someone feel empowered in this changing process. You don't have to be fake or overly complimentary, but you can acknowledge the effort that they're putting in and the small steps that they're taking toward reintegration. So I will tell you about a case study of mine. All of the names have been changed and some important details have been changed in order to ensure his privacy. John was recently released from prison for a nonviolent offense, but he also has a history of domestic violence charges. He alternated between being argumentative and stonewalling, refusing to answer some questions, shouting at me in response to others. Talking to him is quite frankly exhausting, and it really puts me on edge. The first step to a trauma-informed approach with John was reminding myself that people can and do change, but that we often don't recognize the signs of change in the early stages of change. I have to start and hold hope that John will be able to reintegrate and function into society, even if I can't readily see exactly how that's going to happen or when it's going to happen. So each day I look for positive changes in my clients like John, even if they're very small ones, or find stories of hope for positive changes in others in order to maintain that hope for me when I'm working with John. It has to remind me that this is hard work, but it is worth it. So even as John is stuck in this initial stage where he doesn't want anything from me and he doesn't want to make any changes, I have to reassure myself that it's still possible. There is still hope. Before I meet with John, I always take a few deep breaths and I think to myself, remember, what happened to get him to this point in his life is why he is at this point in his life. This isn't an excuse for his behavior, but it helps me to understand John is making decisions with faulty equipment. John is making decisions out of life experiences that taught him to behave in a particular way. And I know that those behaviors are not productive or adaptive in this context and no longer adaptive at all, but somehow they had survival value for him elsewhere at other times in his life. Whenever John gets agitated and oppositional, I have to remind myself, this isn't personal. This isn't about me. This isn't a failure on my part. I would probably feel like this if someone was asking me these things too. I would probably feel like this if I was in John's position, where all of his life people have been lecturing him and telling him how he is a failure. I know that kindness and a non-judgmental approach will be much more effective in helping John than arguing or getting into power struggles. And so I take care in particular when I meet with John to make sure that I have got myself in the right mindset. And also, when I leave my meetings with John, I make sure I have a few minutes to decompress. During one of my earliest meetings with John, I would say to him things like, I'd like to get to know you better. Tell me your story. How did you get here in your life? How did you get to this point? You can start at any age and any point in your life, but where does your story start? And when I asked John this question, he started in childhood, describing a lot of time alone with little parental supervision. And when his parents were home, he witnessed his stepfather berating and hitting his mother. And he was often berated and whipped himself. He stayed away from his house as much as possible to avoid conflict. And in order to stay away from that really unhappy environment, he spent most of his days at a local park where he met another group of older kids who introduced him to drugs, engaged in vandalism and petty theft. They picked fights with anyone who crossed their turf. He just generally was looking to leave a really, really abusive environment and neglectful environment, and he found one that was much more exciting, problematic, but also was adaptive and actually probably a natural response to being in a neglectful and abusive environment home is to find another environment. But of course, he found an environment of antisocial peers. When John described his academic history, he struggled in school, both academically and behaviorally. He got in trouble all the time. And he said he was the, quote, dumb kid who was always in trouble, unquote. By the time he dropped out of high school, he had already been arrested multiple times, and his stepfather had only stopped beating him when John was big enough to intimidate him and threaten to beat him in response. Most of John's adult life had been spent barely employed, drinking heavily, and getting into fights, because that's the behavior that he had done for most of his childhood and had served him well in keeping him away from the abusive and neglectful home environment and then safe on the streets with antisocial peers. Knowing this information, I can see that no one has ever taught John how to manage his emotions or engage in appropriate behavior. He learned behaviors that were productive in those other environments, but they're not appropriate in polite society. The adults in John's life either punished him or outright abused him, and he grew up thinking that he was a failure who wasn't capable of anything more than the life that he was living. When I asked him, "What are you good at?" he answered, "Effing up." Not in those words. I pointed out that he was actually pretty good at surviving. He found a way to stay out of his home as a kid, which was pretty normal and natural response to such an awful place. And he was making the best decisions he could with the resources a kid has at that age. Even though what he was doing wasn't ideal, they were effective at getting some of his needs met, some of the time. So we agreed to continue looking for and highlighting some of the strengths and the ways that he had survived and how we could change those behaviors to be better adapted to the rest of the world. And we wanted to look at the ways that his adaptive behaviors could keep himself out of trouble. Whenever possible, I still give John choices. I say things like, "Would you like to meet Wednesday or Thursday next week? Would you like to start by talking about X or Y? And even though these seem like really minor choices, they are small opportunities to give John control. And even though I have a lot of goals for him, I see the full spectrum of things that he needs to work on. When we are setting goals, I ask what's most important to him to focus on first. And after he describes his goals, I then describe the next set of goals that I have for him. And we negotiate. So we make sure that some of his goals and some of my goals are being worked on at the same time. Honestly, we know some goals aren't really negotiable, and I make sure to acknowledge that those goals aren't negotiable when I am talking to John. And we also have to focus on the things that are important to him. And now, after working with John for some time, if I'm not giving equal airtime to his goals, he will make sure to tell me and say, like, haha, we've talked about yours for 10 minutes. Now let's talk about mine. So, to recap these tools, working with someone like John can be really, really challenging. And I know there's an extensive trauma history in his past, but also from his time while he was incarcerated. The first tool that I use when I'm working with somebody, particularly those challenging clients, but all clients, is adopting that trauma-informed mindset. Making sure that we are doing things to try to resist re-traumatizing someone. By using that collaboration, by empowering them, by being transparent whenever possible, by making sure that I'm acknowledging those power differentials. I'm also really working on my mindset to make sure that I'm recognizing that they are making decisions with the best resources available to them. They're making decisions with a brain that was sculpted by trauma and adverse childhood experiences. And the reason they're still alive today is because that brain figured out a way to survive. And now it's not going to work to do that anymore. But I know that what happened to them is the reason they behave the way they do today. I make sure that I'm using those trauma-informed behaviors when I'm establishing that relationships. I ask questions. I'm curious about them. I want to know, what are their strengths? What do they want out of their life? And finally, whenever I'm setting goals and working with them, I try to use as much choice and collaboration and empowerment and encourage them as they continue to make these changes. Even the smallest change, especially early on, needs to be acknowledged. Don't have to celebrate it, but it needs to at least be acknowledged. By using these 3 trauma-informed tools, and many that are still available out there on the Substance Abuse and Mental Health Services Administration website, you can have a more productive interaction with your clients who likely have trauma and adverse childhood histories. If you have any questions, please feel free to contact me at sara.winegar.budge@gmail.com.